All right. Yay.
Yay.
It's so good to see you, Beryl. My name is Amanda Finley. I'm with COVID-19 Long Haulers Discussion Group, and I'm excited to have you back for a town hall on filing for disability. Beryl, thank you so much for being here. Tell us a little bit about yourself, where you are.
Well, first of all, I will say that I'm excited to be back again, to be asked to come back again. I really enjoyed the previous two town halls that I did, and it really helped me to learn about a lot about COVID long hauler
It's
uh,
awesome.
people and how I can best help them.
And you've done an amazing job.
I
Thank you.
I I'm sorry.
And you've done an amazing job. Thank you.
Oh, well, thank you, and you do an amazing job too,
Thank
and
you.
we all appreciate all that you do.
We
I
just
know
love
I
for you.
certainly do.
Thank you so much.
But I have my own disability service, Beryl Terrell Disability Advocate Service. Been in business now since 2016,
Mhm.
still going strong. Not only do I assist long COVID clients, I assist all clients who have any type of disability which renders them unable to work. I enjoy what I do. I'm a service oriented person. It just comes naturally to me, even though I try to fight it sometimes. But it's what I do. It was what I was put here to do, and I enjoy it.
I would say so. Yeah. Well, thank you so much.
You're welcome.
Let me pull up our questions here, and I did tell them that if they have questions, they can put it in the live feed, or so I might you might see me on my phone. I'm paying attention, but like, hey,
Okay. All right then.
let's see. Uh, let's start out with this one. What's the difference between a disability advocate and a disability attorney?
The very little. The only difference for me, between a disability advocate and a disability attorney is, of course, the disability attorney has gone to law school and has gotten a law degree. As far as the experience and what they're able to do, it is equal to a disability advocate. Uh, Disability advocates, to me, are more customer service oriented with their clients. We deal with our clients from the beginning, from the time that they make that first phone call, all the way through the process. Whereas a disability attorney or use their staff, a paralegal or an assistant, to handle that client from the beginning and only come in at the end when there's a hearing or when it has to go to an appeal or something like that. So those are the two main differences.
And is this something I have to pay for up front, or how does that work?
The fee for a disability attorney and a disability advocate is 25% across the board, and that's set by Social Security.
Okay.
And it just went up this past November to $9,200. So it's 25% or $9,200, whichever is less. There
Well,
is no money due up front. If we win the case, and only if we win the case, those funds are taken out of the whatever back pay that that client would receive from Social Security. So there's no out of pocket money that is needed from the claimant at all.
which is a very good thing for a lot of us who haven't been able to work. So
Exactly, because most people, I mean, if you're applying for disability, that kind of tells you, well, I'm not working, so I don't have the money. So how am I going to come up with this money to pay an attorney or an advocate? Well, you could be assured that you don't have to come up with any money.
that's great. That's great.
Yes.
What's the difference between SSI and SSDI?
SSDI is Social Security Disability Income. SSDI is for those people who have worked and paid into the system. If you look at a normal paycheck, whether you're paid monthly, biweekly, whatever, you will see a section, it's called FICA, FICA. That is disability money that is taken out of your paycheck whenever you get paid and set aside with the government, just in case you may become disabled. Okay? SSI, on the other hand, is Social Security income. It is for people who either have not worked or have not worked long enough to accumulate enough money to be able to get disability. It's a type of federal welfare program for those who are disabled but don't have enough money in that pocket to be able to get disability
And
otherwise.
yeah, that's a question I had also about someone asking, well, I worked in the gig economy most of my life up to this. Is there anything out there for me? Could I even apply?
Right, right. And it's based on credits too. Every Social Security, you have to have 40 credits to be able to get SSDI. 40 credits means you worked 5 of the last 10 years prior to your disability. If you have not, you would have to apply for SSI to get that federal SSI disability.
Okay, let's see. Let me just look it up here. When should I consider applying for disability?
Well, Social Security says that you're disabled if you're not able to work for 12 months, or if you foresee that you're not going to be able to work for 12 months or longer, or if the impairment or illness that you have is going to result in death. And of course, you can't work anymore. That is the time that you want to apply for your disability. It's a long process, and I don't sugarcoat that for anyone. I always tell my clients it's not a quick process. And since COVID, it's even taken even longer to get from one stage to the other. So as soon as you realize that you're not able to work, and you know that you're not going to be able to work for a projected 12 months or longer, you should go ahead and contact Social Security to apply for your disability.
Let's see. Does my age affect my odds of getting disability?
It is a factor, but one thing to consider, and it's specifically for COVID long hauler clients that I've had, most of those COVID long hauler clients fall within that. Most adults who got the COVID long hauler were probably between the ages of 35 to 49. Okay. That's what I've seen from my research at the CDC. And according to Social Security, 49 and younger, that's considered a younger individual.
Yeah.
So you may think that that may hurt you as a COVID long hauler client, but it doesn't, because uh, since that age is specific for a COVID long hauler patient, that can actually work for you as opposed to against you, because we know that that age range is the one that is most significantly impacted.
And we had a similar question in a previous town hall. If I'm in my 60s, is it even worth applying for disability at this point?
Oh, definitely. It definitely is worth applying. The only time that I would say that there would be no need for you to apply for disability is if you have reached 66 and a half, because that's when you reach full retirement.
Yeah.
And you're going to be able to get your retirement money. Because if you were getting disability prior to 66 and a half, when you become 66 and a half, that disability money is going to transfer over to retirement money anyway. So it's basically the same thing. It's coming out of two different pools.
Okay.
So if you're 66 and a half, go ahead and get your retirement money. If you are under 66 and a half and you have a prior condition, because you're going to get paid for those back benefits for the time you were disabled. So yes, definitely go ahead and apply for your disability benefits.
Yeah.
And that's why it's important to talk to an attorney or an advocate to verify that information, because a lot of people think either they're too old, I'm too old, I'm too young, but every disability client is unique. Their situation is unique. So they need to at least make a phone call. I mean, if they don't want to call me, they can call another advocate or another attorney just to get some clarification about their particular situation.
Yeah. And I do send a lot of people your way. I don't know, ask Beryl. I just live here. Let's see. If I get accepted onto SSI or SSDI, would I be taken off of my mom's health insurance that I have the grace to be on until I'm 26?
Well, with SSI, if you are approved for disability, you will be getting Medicaid. So you no longer need to be on anyone else's health insurance. SSDI, if you are approved for disability under that umbrella, you would be getting Medicare. So you would have your own medical, health insurance. So you would not need to be on anyone else's health insurance. You'd have your own. Yeah. And a lot of times that's even more reason to apply for the disability as opposed to the money. Sometimes you need that You need those help. You need to be able to go to the doctor.
Yeah.
And a lot of people can't, you can't, no one can afford to pay out of pocket to go to the doctor. So that is an advantage of being able to get your disability. You're either going to get Medicaid or Medicare, according to which one of the disability umbrellas you fall under.
Yeah, and that's a this kind of leads into the next question. It's all overwhelming. Someone wrote in and said, "I'm stuck. I'm overwhelmed with all the legwork that goes into this process. How can I get help?"
It's understandable that you're stuck. It's can be very confusing how to maneuver the process. To me, that's even more reason to get someone that is experienced in how to maneuver. I mean, it's like if you have a fire at your house, you're not going to put the fire out yourself. You're going to call the fire department because they're the expert in that area.
Yeah.
They know what to do. They know how to stop that fire. We might put water on it where it needs to have something else done. So it's the same thing with being a disability advocate or an attorney. We know what to do. We know what to say. We know who to talk to. So you always want to go to the expert. And I know a lot of times people don't want to pay the 25% or the back pay, but you have to realize that you're paying someone for their expertise. You're paying someone to win a case for you that increases by 60, 65, 70%,
Yeah.
as opposed to you doing it on your own. So is it worth it to be able to have an income that you can depend on and, have some money coming in, have some health insurance coming in, to pay someone? I would say that it is.
Yeah. Yeah. And it's if people can go it alone, but wow, it's a lot.
Yeah, and people do go it alone. They do, and there are some people that win alone.
Yeah.
But the majority, if you were to do the research and look at the majority of cases, the chances of winning increase greatly by
Yes.
having someone that's kind of on the inside do the work for you. And because they, like I said before, they know what to do and they know when to do it. And those two factors are very important when you're dealing with disability.
Yeah. Major depression is one of my debilitating symptoms. COVID made it really bad. Should my mental health or the fragility of my mental health be made a factor in my disability claim?
Oh, definitely, definitely. And even not even speaking specifically for a COVID client, but just a disability client. Most people who deal with physical disabilities, they realize that they create mental disabilities also.
Yeah.
Anxiety, depression. So it's important to, it's like, if I didn't have this sciatica, would I be depressed? No, you wouldn't be. So, because the sciatica is keeping you from working, so you're depressed because you're not able to contribute. So those mental, those mental issues that you might be dealing with are just as important as the physical ones. So you
Yeah.
want to add in everything that's affecting your ability not to work.
Yeah, and I think that's this is one of the most common questions I get. People want to know, well, what should I put on here? Should I put that or should I put that? And it's best just to put all of it.
Put all of it down. Anything that pertains to your disability that prevents you from working, whether it's physical, mental, or both, you want to uh, put that down when you apply for your disability with Social Security.
Yeah.
And also make sure you have medical evidence to prove that disability. That's extremely important. That's your witness to the disability. Yes.
And that's the perfect segue to this one. I've heard documentation is key. What are we talking about? Should I take the time to write up a diary of what happened, starting back at the beginning? Should it include relevant doctor's records or imaging write-ups that validate what I document?
You want to have every piece of medical evidence that you can get concerning your disabilities. The individual does not have to write anything down per se, but they want to make sure that they go to the doctor.
Yeah.
And a lot of people think, well, what if I can't afford to go to a primary care, or I can't afford to go to a specialist. I hear that all the time.
Yeah.
But even going to the emergency room,
Yep.
that's documented medical evidence. So whatever you have, whatever doctor you see, whether it's a specialist, primary care, emergency room, you want to make sure that you let whomever is, whether you're taking care of your own case or an advocate or an attorney, you want to make them aware of every doctor's visit that you go on. And even if you go see a nurse practitioner,
Yeah.
it doesn't have to be a doctor. It's
Yeah.
just anyone that you're going to see pertaining to your impairments. You want that documented, and you want us to know about that because we want Social Security to know about that.
And someone had a really interesting question. They wanted to know if the documentation from their wearable device, like the visible band or Fitbit or Aura Ring, is that something that I can contribute to my documentation?
Yes, it is. That is medical evidence.
Yeah.
I mean, that's, X-rays, any type of data, imaging, whatever, it's still medical evidence. And the judge does make note of that. If we would have to go to a hearing, they will look at that type of evidence just as much as they would look at written medical records from your medical provider. So all of that is equally important. Yes.
And this is I'm gonna ask the same question but in a different way, just because someone asked it.
Okay. Go ahead.
Which doctor should be the main doctor of record for the disability filing? My primary care, my long COVID recovery doctor? There are dozens of health problems going on that I see specialists for. What roles do they play?
All of them. There's not one, because all of them are dealing with you with your issues. All of them are going to have their input as far as how your impairments are impacting you. So, like some people will only have a primary care; they can't even afford to go to say an oncologist or a cardiologist or whatever. So, whatever medical evidence you have is important. And you can't say that a primary care is more important than a specialist or even a dentist, because your dental records can show that there is impairments, that there are disabilities that you have. So they're all equally important. And you want, a lot of times people think that, if I go to the dentist, I don't need to put that dentist down as one of my medical providers. Yes, you do.
Yeah.
Because everything in our bodies affect everything else. So we need to be aware of that. And they may mention key points that could be the deciding factor between whether you win that case or whether you don't, because you did or did not give us that medical information to review and to share with the judge or with the hearing department.
Let's see. If I'm approved, can I still work in a remote job without funds being taken away so I can afford a COVID safer environment, an apartment by myself? How much income would I need to make in order to be kicked off of benefits?
Social Security says that you're disabled if you're not able to work. You can work up to 25 hours a week, okay, and still get your disability benefits. You can make no more. As of 2024, it was $1,370 a month gross. So you have to look at both of those things: 25 hours a week or less, $1,370 a month gross or less. It can't be one or the other. It has to be both. Because if you're working more than 25 hours, or if you're making more than $1,370 a month, you're considered a full-time employee and no longer disabled.
Yeah.
Because disability means I can't work full-time.
Yeah.
But if you're working full-time, that means that according to Social Security, you're no longer disabled. And they will stop your funds, believe me.
Let's see. Is there a limit on how many times I can apply?
There's no limit. No, there's no limit. I mean, you go through the process. You go from your initial application. If you lose that, then you appeal that to the reconsideration stage. If you lose that, then we move on to the hearing stage. If you lose that, then you let's say you stop at the hearing stage and you lost that and you didn't win. Okay. If you don't appeal that decision, Social Security gives you 60 days to appeal at each one of those levels. If you don't appeal, that case is closed. It stops. So if you call back, say 90 days later and say, I want to start a new claim, you can do that. That old claim, no matter how many it is, no longer exists in the Social Security world. So you can apply as many times as you want.
Yeah, that will make someone's day hearing that. That was a question that came up a few months ago. And this person thought that they once the judge said no and that was it, that they couldn't do it again. So
And even after if the judge says no at the hearing level, you again have that 60 days to appeal. You can appeal to the appeals council.
okay.
And the appeals council is a group of seasoned judges who will review that hearing judge to say, to see if they did follow protocol and did what they were supposed to do. So there is a next step after the hearing level.
Okay.
There is also a next step after the appeals council level, and that is the federal court. And you can take your case to the federal court. As you go that way, the chances of winning maybe decrease. So my advice to clients most of the time is to start the process over again.
Yeah.
If you're still disabled and unable to work, instead of going to the federal court, because that's going to be another year that you would have to wait for a decision, start your case over again. And while you're waiting for that federal judge to make a decision, you started your claim already. Because time, like I said earlier, it's a long process,
Nice.
and you want to save as much time as you can. So people want to look at those things when they are denied.
This is a good question. As I'm going into my hearing, what should I expect and how should I prepare?
What I do with my clients a week or two prior to the hearing, I set up an interview and I go over with them exactly what to expect and what to do. Um, and it's kind of standard, but both the judge and myself will ask questions about the medical evidence that's in file. We've already gotten that. We'll ask clients questions about their disabilities and how they impact that. There's no standard question, but you're going to be asked about your previous job history. You're going to be asked about how your disabilities affect you. Uh, you're going to be asked about why you can't work. Uh, Maybe not in that way, but there are various ways that you're asked those questions. Um, my best answer to a client when they ask that question is tell the truth. You don't have to rehearse anything. You don't want to write anything down. This is your life. This is your life. Nobody knows better than you how to answer how you're feeling, what's going on with you. So you go in there and you tell the truth. And realizing that most of the questions that are asked, we already know the answers to already. We just want your interpretation of how things are affecting you, because we already have the medical records, from the various providers you've gone to. So best advice, go in, no rehearsal, tell the truth. Keep your answers short. We don't, if I ask you what your birth date is, I don't need to know what hospital you went to or how much you weighed or who was in there with you. I need your birth date, and that's it.
Yeah.
If we need additional information, we will ask for that. But it's very informal. A lot of people think it's like the Judge Judy's on TV. It's not like that. It's like, yeah, it's not like that. You go in and it's very informal. You're introduced, your attorney or advocate is introduced, and once the judge verifies that you are who you say you are, it's basically a question and answer about your medical history and your job history.
Yeah, and I think some of the anxiety leading up to that, it creates a crash afterward, and those are.
I've never known. I can't even tell you how many clients I've gone to hearing with. I can't. That is, it's probably thousands now.
Right.
I've never had one that wasn't nervous.
Yeah.
I'm nervous when I go in, because you don't know what to expect. Every situation is new. Every hearing is new. But once you get in there, I tell clients, once you get in there and you sit down and you start having this question and answer conversation with the judge and with me, that anxiety goes away. I guarantee you.
Yeah, it's an intimidating process. It's very
It
formal
is. It
process.
really is. Because you don't know what to expect. It's different. You've never had to do this before.
Yeah.
And you're talking about yourself. So it can be very, intimidating. You're right. But I'm right there with you. We're right there with you, whether it's on the phone, whether it's by Zoom, or whether it's in person. Your advocate or your attorney is going to be right there with you.
See, I'm gonna skip down here. That's okay. Is my disability income taxable?
It can be. And that's kind of an individualized question and
Yeah.
based on what your tax liability is. Uh, my best advice for that, I'm not an accountant. I do have someone that I work with that I do send my clients to once they are approved. And that would be a question for him to answer. But it's basically based on the individual and what their tax liability maximum is. So that would be something that would be determined once you got approved for your disability.
Let's see. Sorry, I'm skipping around here. I'm trying to make
Oh,
sure
it's
I'm not asking like the same question over and over again. How do I find an advocate or attorney?
Social Security, you can actually call Social Security and they have a list of advocates and attorneys that they can refer you to. Some people Google, go online and Google advocate, disability advocate or a disability attorney. I would say it's really easy to find one.
Yeah.
Mhm. And a referral. I mean, I can't even tell you how many referrals I get from
Oh,
people who have worked from you
yeah. Yeah.
all the time,
So
all the
yeah,
time.
16,000 people. I'm like, talk to Beryl.
And I think that's the best way to get somebody who's good. You
Yeah.
know, word of mouth is the best way to get a good attorney or a good advocate.
Yeah.
But they're out there. They're out there. Yes.
This is an interesting one. I live in a recreational state for marijuana, but it's still not legal at the federal level. Could I lose my benefits or my case based off of a drug screen?
Okay. Can you repeat that?
I'm sorry.
I'm sorry.
I live in a recreational state for marijuana, but it's still not legal at a federal level. Could I ever lose my benefits or my case being based on a drug screen if it comes back positive for marijuana?
That's a difficult question for me. That's again a very individualized question. I I couldn't answer that. I wouldn't. I don't feel comfortable answering that. I mean, have I had or do I have clients that use marijuana recreationally? Yes. Do they have disability and are
Yeah.
yes,
Oh yeah.
but that's specific for them. So I could not say for
Yeah.
that particular situation because another thing, I don't know enough about that person
Yeah.
either to
Right.
answer that question.
Yeah.
So I
There are a lot of,
apologize.
oh no, it's okay. There are a lot of murky areas, a lot of liminal spaces where, I know, it's not something you
Yes.
can predict, like the weather in Missouri.
Exactly. In Georgia, right?
Right? God,
Yes.
it was 51 degrees yesterday. It's 2 degrees now.
Oh my God. Oh, I just get cold thinking about it.
Well, we got a
Oh,
foot of snow and ice last week, and I was sick, and I was like, I'm just gonna sleep it off. Y'all tell me when it's gone. Where are we going here? This has been a hot topic in the group lately. With the new administration coming in, what are the risks being posed to those on disability currently, and all those that are newly disabled seeking support? That's a big question. That's another hard one to answer.
but you're frozen on my screen,
Okay.
and I missed I heard it. I
There.
heard you say with the new administration, and that was it.
Okay. Yeah, it froze on my screen too. I'm sorry. With the new administration coming in,
Oh,
what are the risks being posed to those on disability currently, and all those who are seeking newly disabled, who are newly disabled seeking support? That's that's a lot.
I, I would say your guess is as good as mine.
Right?
We're just going to have to wait and see what's going to happen. I don't know. I mean, I think about that too, even as far as us as advocates and attorneys working for the government under the new administration, we just don't know. It's just going to be a waiting game for us all to wait and see what's going to happen under this new. Does it scare me a bit? I'll admit that it certainly does. But I say keep doing what you're doing. If you're disabled and you need to apply for your disability, don't wait to see what this new administration is going to do. Go ahead and apply for your disability. and we'll work through that. Because you never know what the government is going to do at any given time anyway. So don't just not do anything because you're waiting to see what they're going to do. Go ahead and put your application in there.
Yeah, and if there are changes, it takes a while for it to take effect. It's not like it's going to happen right away. So start it. So
Exactly. I mean, people who apply for disability, they wait long enough anyway.
yeah,
You wait for years, months to get from one stage to the other, and then the time's going to pass by anyway, no matter what the administration does. So you might as well be as active and proactive as possible in the process. That's how I look at it.
is it possible never to get disability?
It is. Again, that's another individual question, but yeah, there are people that apply for disability that are either not disabled or can't prove their disability, whether it be with no medical records or the judge doesn't feel that the medical records prove that they are disabled. So of course, no, you're not going to get your disability. So
Yeah.
it can happen, yes. But that's why I'm very particular. And I tell clients, I was even telling a client this, well, she mentioned it to me yesterday. She had called to do a consultation. Another one of your referrals, Miss Amanda Finley, she called yesterday, and I was talking with her, and she was saying how I always tell people, go ahead and apply for your disability. Don't, we always think of a way not to do something because we talk ourselves out of, because this person is not going to take me on as a client, or my disability is not that bad or whatever. You owe it to yourself. If you feel that you're disabled and you're not able to work, you owe it to yourself. You've paid into the system all these years. Now you need the system's help. Apply for your disability. That's the best advice I can give anyone.
Yeah. And that's how can people reach you?
Well, they can reach me, our office phone number, 678-755-1229. They can go on our Facebook page. We have a free consultation that's on there. They can send an inquiry in, letting us know that they would like to set up a time for us to talk. And they can send us an email. Either one. Our email address is blhdisability@gmail.com. And again, it's a free consultation, so you have nothing to lose,
Right.
Just call in, have a conversation. Let's see what we can do.
Who can you work with? Do I have to be in your state, or can I be anywhere else?
I work with clients throughout the United States, from as far west as California, as far east as New York, South Florida, Arizona. I mean, I have clients all over. I even have a client now in Puerto Rico.
Oh, nice.
So
Cool.
wherever you are, if you need our help, and a lot of times people call in and they want to speak to me, and I'm not able to speak because either I'm working on a case, at a hearing, or whatever. Just call in. I have two really fantastic assistants. They always refer to me. I always have the last word as far as not able to speak to me. I'm not involved in your particular disability consultation. Please give us a call. If you're calling in, you must feel that you are in a situation where you need help, and we're going to do everything we can to evaluate your case and see if we're able to help you.
And this is I think this I've seen this a couple of times where someone has been awarded disability, but they actually could have been awarded more in disability. Is that something that can be appealed?
It is something that can be appealed. Again, I would have to look at the individual situation and why they did not get as much as they thought they would get. A lot of time, but sometimes you want to be very careful with that, because you don't, you got something. You don't want to challenge the judge too much, because, I hate to say this, but sometimes they may take that a little personal.
Yeah.
And may say, well, I'm not going to give her I'm not going to give him or her anything. And they could amend that decision and take your disability away. So you want to be very careful and know that you have proof that you should have gotten the full amount that you thought you should have gotten before you go down that road.
Yeah.
And you definitely want to have an attorney or an advocate take care of that for you. You don't want to go along with that.
Oh gosh, yeah.
Yes. Mhm.
I think I actually, wow, we actually have time left over. That's a first.
Yes.
And I'm not seeing any questions in the chat. So what other gems would you like to leave with us?
The gem that I would like to leave, Amanda, is I hear over and over and over and over again people comparing their disability, their impairments to someone else. And I want to say to everyone out there that's listening in, your case is unique. If you feel that your disability is impacting you to the point where you're not able to work because of those impairments, you owe it to yourself to call. You don't have to call me, to call in and speak with a disability advocate or an attorney and file your disability claim. Don't worry about the fact that so and so and so and so didn't get theirs or another person got theirs. Look at your case.
Yeah.
Also consider the time. Time's going to pass by anyway,
Yeah.
whether you file that claim or whether you don't file it. If you are disabled and you're not able to work, go ahead and file your claim. And if you don't file it, we know you're not going to win. But if you do file it, that advocate or that attorney is going to do everything they can to win your case for you.
Yeah.
So reach out to someone for the help.
Yeah. I think that's it's almost invalidating to to think, oh well, they've got it worse. I'm not that bad. No, it's still affecting you. This is still bad.
I hear that all the time. So and so is worse off than me.
Yeah. Hey, you're struggling too. You're both drowning. You are both drowning.
Yes.
You might be drowning in different ways, but you're both drowning.
But you're still, that's exactly right. That's exactly right. So do yourself a favor and call in and speak to someone and start the process.
Yeah.
Mm-hmm.
Well, thank you so much, Beryl. I always appreciate your time and your knowledge and your willingness to work with us in so many different ways. And it's good to see you.
It's good to see you always, Amanda. And thank you for the invite. I really appreciate it. Like I said, there's something in my heart as far as handling COVID, having COVID long hauler clients.
Yeah.
And I'm happy to speak with them or you at any time and assist in any way that I can.
And thank you so much for that, because it's a very gaslighty and validated world out there, but
yes, it is.
we need people like you. So
thank you.
Well, you take care, and I'll catch you on the flip.
Okay. All right. Thank you, Amanda. Bye-bye.